Hey, hi, hello everybody. I'm Meg and this is M&M in real life. I know we're a couple weeks late on this, but we are going to start talking about Postural Orthostatic Tachycardia syndrome today, also known as POTS. But first, let's check out that medical disclaimer. Welcome back, guys. Thanks for watching that. So we are going to get started talking about POTS. And POTS is very complex and complicated, and there's lots and lots that goes together with it. So we're going to just start by breaking down the terms themselves. So postural refers to the position of your body, like whether you're laying down or standing up. Orthostatic refers to low blood pressure that happens when you change position from laying down to standing up. Tachycardia refers to an increased heart rate, usually over 100 beats per minute, and that happens because your body is trying to increase its blood flow. And as I had mentioned in the first EDS video, POTS is commonly diagnosed along with EDS because they typically go hand in hand with each other. To better explain, EDS patients often have dilated veins that cause poor circulation, and that poor circulation can cause dizziness, fainting, rapid heartbeat, fatigue, headaches, and many other symptoms that we'll talk about in a little bit. But all of those things can be used towards a POTS diagnosis. And similar to EDS, there's what seems to be an endless list of symptoms that go along with the diagnosis. So there are specific diagnosing criteria that confirm a diagnosis, which is either a heart rate increase of 30 beats per minute or more, or 120 beats per minute within the first 10 minutes of standing. And the heart rate is measured while laying down and then again at an upright position, 2, 5, and 10 minutes after changing that position. And the same thing can be done using what's called a tilt table test, and that is literally the exact same thing, just done by a doctor. And so some of the additional symptoms, there's the headaches, fatigue, brain fog, dizziness, lightheaded, shaking, fainting. All of those things can come on at any time. It's very hard to predict when those symptoms may appear. It may be after literally just sitting down to standing up. It may be after you get out of a shower. It may be after you go up a flight of stairs. There's so many things that can contribute to what causes those symptoms. And it also just depends on the person. Once again, all of these symptoms just kind of affect everybody a little differently. So if you have POTS, you kind of figure out as you go what might help with certain things. So I have found that an ice pack helps tremendously with headaches, as well as sunglasses sometimes if it becomes a migraine. Drinking plenty of water, which is extremely important for us, and it helps with dizziness, lightheadedness, and I, for one, am extremely terrible about drinking enough water, but I'm working on it. I've also found that salt tablets help with POTS symptoms, which has actually been recommended to me by a doctor as well. So what it's supposed to do, it's supposed to help your body retain more water, essentially so that it helps your blood circulation, and it should help with the dizziness, fainting, and those things. Once again, I've included today's information in the video description, so please take a look at those. And thank you for watching today's video. Please like and subscribe, and I will see you guys next week.